Texas A&M University College of Veterinary Medicine and Biomedical Sciences Peer Program's continuing video conference series. Today, Dr. Mark Stickney from the Texas A&M Small Animal Teaching Hospital will be talking to us about Keep It Clean. He'll talk to us about homeostasis and the aseptic technique. How do we keep microbes and other bugs out of our patients as we try to heal them and help them through surgical methods? We hope you enjoy our program and welcome you here.
It is great to be here this morning, and I'm excited to have this opportunity to talk with you. At the vet school at Texas A&M, I am one of the surgeons that teaches our veterinary students how to perform surgery safely and correctly on small animals like dogs and cats. And a large part of performing surgery is part of maintaining homeostatic mechanisms to help prevent infection during surgery. So a lot of our talk this morning is going to focus on homeostasis and the way that our bodies keep themselves regulated and functioning normally. Homeostasis is the ability of the body to maintain its internal stability or its internal balance. So you never want your body to go too far in one direction or the other, and I'm going to give you some examples of that here in just a few minutes. If you cannot maintain homeostasis in your body, then that will lead to some sort of dysfunction in your organs, disease, or death if things go too far in one direction or another. But let me give you a little bit of an example of homeostasis. So here is a container that is filled halfway with air and halfway with fluid. And we're going to pretend that this is a system in your body. Now, right now, everything is perfectly balanced. It's half and half air, half and half fluid. If, however, we get shifted over in one direction or another so that some aspect of my body becomes imbalanced with the fluid or the air, and now you can see that we've got more fluid on the bottom and more air here toward the top, homeostatic mechanisms within our body are going to work to shift that balance back so that we are in a neutral state where we most want to be. So, what are some ways that our bodies maintain homeostasis? What are some ways that plants and animals maintain homeostasis in nature? Well, first let's just talk about plants for a moment. Plants need sun and they need water in order to survive. In Texas, water can be a problem. So plants will grow root structures deeper and more widespread into the ground in order to find moisture that is trapped deeper underground so they don't have to depend on infrequent rainfall in order to get the water they need. If they don't get enough water, you'll see that a plant starts to wilt. And that is because there is not enough water, not enough fluid in the cell structure of the plant to maintain its rigidity, so they begin to wilt. When they do get more water, that wilting will resolve itself and they will begin to stand straighter up again. Plants also need sunlight. That's not a problem in Texas, but in some places it can be. And what you'll notice with plants, if you were to watch them very carefully, if you watched a flower very carefully throughout the day, you would notice that it was able to turn and face in the direction of the sun as the sun moved across the sky. And that way it is able to capture as much sunlight as possible to maintain photosynthesis and keep its energy reserves at the level they need to be. For us, a couple of examples of homeostasis include if we were to get something in our eye, a piece of dust or an eyelash in our eye. Our eye doesn't want anything in it. It has to be perfectly clear in order to see. So we will begin to do things like squint and start to produce tears in order to try to wash that out of our eye so that our eye can again become clear and maintain our vision. So that's an example of a homeostatic mechanism. Another example is if we were to cut ourselves. We've all done that at some point in time. And one of the first things that our body does when it clots, when we get cut, is it tries to create inflammation and a blood clot. We need to have a certain amount of blood in our body, and when our body recognizes that we are losing blood, it will immediately cause the area to swell to try to make the cut smaller, and it will move in platelets to create a blood clot to stop that blood flow from happening. And in that homeostatic mechanism, we are helping ourselves by keeping our blood in our body and not out on the floor. So microorganisms play a huge factor in our homeostasis of our bodies, of ourselves and plants and animals. Microorganisms can be classified into 5 different categories, and those are going to be bacteria, fungi, protozoa, algae, and viruses. An example of a virus would be the flu virus that we can run into during certain times of the year that can make us very sick. Bacterial infection would be something like E. coli that we hear about in the news when people eat food that has not been properly handled and they get very, very sick with gastrointestinal signs. Microorganisms are present every place. There is not a place on Earth that you cannot find microorganisms. They cover our bodies, they're in the soil, they're on almost any surface that you touch. They are free floating in the air on water droplets and in the wind. They can be found in the ocean. They can be found in the snow. They have found bacteria that live in Antarctica, the coldest place on Earth, where you would think that nothing could possibly survive. There are bacteria that grow there. They have also found bacteria in the very bottom of the ocean near heat vents where the temperature would boil one of us instantly. There are bacteria that are able to live there. There are bacteria every place. There is nothing we can do to ever get away from them. Bacteria can be helpful and they can be harmful. For example, our bodies are covered with bacteria. Our skin is covered in bacteria, and specifically one of the ones that we will find is Staphylococcus aureus that covers our skin. That bacteria on our skin is preventing other bad bacteria from getting onto our skin and causing an infection. So you can kind of think of it as a little war, as a little tug of war, where we have a normal level of bacteria on our skin. Other bacteria show up and they say, I want to go live on your skin, but your good bacteria that are already there will fight them off and say, no, this is our home, you're not welcome here, go away. We also can find bacteria that are helpful in our food. Remember the last time you went and had a big, juicy, perfect steak? If it had been aged, what aged means is that we let it sit there for a while and let bacteria break down some of that muscle tissue. And that's what makes it so juicy and tender when we eat it. And that's an example of bacteria helping us. Plants have bacteria in their root structures that help them to absorb the nutrients from the soil and break those down. And finally, bacteria, virus, fungi, protozoa can all be harmful to us as well. When we encounter some of them that do not belong in our bodies in numbers that are high enough to overwhelm our natural defenses, that is when we get sick. To define some terminology for microorganisms and how they cause disease, let's talk about a pathogen. A pathogen is a microorganism that has the potential to cause disease. Virtually any microorganism can cause disease if you were in the right situation, thrown out of homeostasis enough for it to affect you. For example, if I have been studying all night for the past 3 nights for a final exam, and I've gotten very tired, my immune system is weaker, I am much more susceptible to any pathogen that I might run into. Normally, I might be able to touch a surface or inhale some number of bacteria, and my immune system could fight it off. If I'm too tired or haven't been eating well, my immune system is not strong enough to fight it off. And that is when I will get an infection, which is when the pathogens are able to get into my body and start to multiply and set up a home inside of me. And infections will eventually lead to disease if they go unchecked. And disease is when I have enough of a bacterial or viral load in my body that it is causing my normal organ function, my normal homeostatic mechanisms to no longer be able to function. This results in a homeostatic imbalance, and my body will try very hard to shift itself back to a normal resting state, but it may not be able to do it, and that's when we end up having to go to the doctor to get some kind of prescription to help us with that. So, there are some key things that have to happen in order for us to get sick from a microorganism. First off, it has to be able to get into our body somehow. Microorganisms have been around for hundreds of millions of years, and they have all figured out, they have all evolved to find some way to get into your body and reproduce. Like any organism, from a natural standpoint, the goal is to be able to reproduce yourself and make more of you, more of yourself. So, they have found ways that they will get inside of us despite our best homeostatic mechanisms to keep that from happening. One example is the respiratory tract. Every one of us has had a cold, probably every one of us has had strep throat before. And that is because those bacteria, that cold virus, were able to be inhaled, or we touched something and then we didn't wash our hands and we touched our face and we touched our mouth and those bacteria got in. Your GI tract, we all have to eat, but if we don't cook our food properly, if we haven't washed our vegetables before we eat them, then we are allowing bacteria to get into our gastrointestinal tract, just like on our skin where we have bacteria that are keeping us from getting an overwhelming infection. There are bacteria all through our intestinal tract that also are helping to digest our food and to keep bad bacteria from getting in there and causing us to get sick. If I eat a gigantic piece of meat that I did not cook properly and I ate loads of bacteria, I'm going to get sick. My normal homeostatic mechanisms of bacteria, healthy bacteria in my gut are going to be overwhelmed. Urogenital tract. We can get urinary tract infections. If you drink way too many sodas and not enough water, you may end up getting a stone, a bladder stone in your urinary bladder, and that then will provide a place for bacteria to live as well. So that's another portal of entry into our body. And then, like we talked about before, one of the most common things that happens is we cut ourselves, we scratch ourselves, and that creates a barrier that breaks the barrier that protects our internal organs and muscle and internal structures from being invaded by bacteria or viruses. In order to make us sick, there are a few common things that all bacteria and all viruses have to be able to do to make that happen. The first is that they have to get where they want to live. They have to get to their target site. For a cold, it's going to be the cells in our respiratory tract. For a bacteria in our gastrointestinal tract, those microorganisms want to get into our intestines and our intestinal villi. So they first off have to have a way to get there. Once they get there, our body is going to try to fight them off. We're going to unleash white blood cells. We're going to have immunoglobulins in our body, antibodies that are going to try to fight that off. They have to, the microorganisms, the bad microorganisms, have to have a way to attach onto their target cell and stay there and not get knocked off by our immune system. Once they're there, they want to start multiplying as fast as they can. And they are going to invade our cells, and they are going to start to make more of them as quickly as they can, because that is their goal, is to make more microorganisms and to use up the nutrients inside of their host. They're going to start taking away our nutrients, stealing our energy, stealing our blood glucose. We feel sick, we feel bad, and that's because these microorganisms are now trying to steal our homeostatic mechanisms that we would normally use. And despite our best efforts, they have to be able to avoid our immune system. And sometimes they're able to do that, sometimes they're not. Sometimes we are not getting better. We've had a cold that has turned into a sinus infection, and we've been blowing our nose for 2 weeks straight, and that's not going to clear up on its own. Our immune system is not able to break that foothold that those bacteria have in our sinuses until we go and get some antibiotics. One of the things that is very important from a surgical standpoint and from preventing infections from happening is called aseptic technique. Aseptic technique is a procedure that we use when we perform surgery that prevents the spread of microorganisms, The goal is to achieve a level of asepsis, a level of bacteria that is so low that our immune systems can handle it, and ideally we will have no microorganisms present at all on our surgery site. If we had to have surgery performed on us about 200 years ago, half of us would have died of an infection. And that was simply the way it was, because we did not understand aseptic technique. Since that time, we have made huge steps in ways of helping to prevent infection from surgery that makes infections, although they are still one of those common complications, they are much less likely to occur, and when they do occur, more easily treated. Okay, so here is a test, and this is something that I do every day. We have a dog, Fiona, who has come in to be spayed. She's going to have an ovariohysterectomy performed. And you can see there that we have 3 images. One is of the lovely dog, Fiona. One is of me, the surgeon. And then the other picture is of our surgical instruments that we're about to use. When we perform the surgical procedure, which of these 3 images represents where the best risk, the highest risk of infection will come from? I will give you 3 seconds to think about it, and then we will say that if you thought it was the surgeon, if you thought it was me, I'd like to say that that is not correct, because I'm going to use excellent aseptic technique and eliminate as many bacteria as possible. If you thought it might be my surgical instruments, also I'm going to say that's not correct, because those have been sterilized and they have absolutely no microorganisms on them at all. So the cause of poor Fiona's infection that she may get is going to be from her own skin bacteria. You'll remember that we said that you have a normal bacteria flora on your skin, and that's great. They belong on your skin. That's part of your homeostatic mechanism to keep you from getting a skin infection. The problem is, now I'm going to do surgery and make an incision inside the dog's abdomen, reach in there and remove organs, and I can now, if I don't have good aseptic technique, I will pull those surface bacteria, those skin bacteria, and put them inside Fiona's belly. And now she's going to get a massive infection and peritonitis, because normal, healthy skin bacteria are now in a place where they don't belong. So our patient is our most common source of pathogens, and for our discussion today, here is our patient. I had to negotiate with my daughter to bring this patient to our talk today. So this is going to be our surgical patient. And right now, it is covered in bacteria. And these sponges, these cotton balls, are going to be our bacteria. So we've got our patient lying on her back, and right now she is covered in bacteria. So the first thing I need to do, since I know that she is the most common source of infection from any surgery I might do, the first thing that I'm going to do is clip off all of her hair around her surgery site, so that I don't have any hair, any bacteria that are hiding on the hair or in the hair follicles that are going to contaminate my surgical site. The next thing that I'm going to do after that is perform a sterile prep on her, which is where I'm going to use an antiseptic soap that is going to remove and kill most of these bacteria. It is impossible for me to ever sterilize an animal or myself. I will always have some degree of bacteria. But as long as I have 100,000 bacteria per gram of tissue, which sounds like it's still a whole lot of bacteria, but that is the amount of bacteria on my skin that a healthy immune system can handle. So I have done my prep where I have shaved the hair and I have scrubbed my patient's skin, so that I have gone from having more bacteria than that to just enough for our animal's immune system to be able to handle any sort of infection. The disinfectant that we use, the antiseptic we use for our surgery, is called chlorhexidine gluconate, and that is a soap, and sometimes it looks pink and sometimes it looks blue, but it is a antiseptic that will kill bacteria, fungus, and viruses on the surface of an animal's skin. And the key to it is that it does not instantly kill anything it touches. What we have to be concerned about is something called contact time. So we're going to scrub this animal, and we usually, as part of our scrub, want that antiseptic to sit on our patient for about 7 minutes before we dry it off and start our procedure. And that's going to give us the maximum amount of kill of bacteria and viruses on that animal. Remember, we'll still have some degree on there though. Now, I have clipped and I have prepped my patient. Now I'm about to do surgery, but I don't want to, I have an area on my animal that I have prepped. I don't want to be doing surgery and end up accidentally touching a paw or a tail or some place that still has hair on it that has not been surgically prepared. So I'm now going to drape out my surgical field, which means that I'm going to place some sterile towels around my surgery field and basically make it so that the only part of the animal I can see is the tiny little part where I'm going to have to perform surgery. That way I can't accidentally touch anything that has not been aseptically prepared. I can't accidentally have my suture drag across the animal's mouth. I'm only going to be working in the area that I'm going to perform my surgical procedure on. Now, we have to now make ourselves as aseptic as possible. Like I mentioned before, there is no way that I can ever make myself and my skin sterile, but I do want to reduce the number of bacteria on my skin so that if I did end up accidentally contaminating my patient, I'm not going to add any number of bacteria that would be more than what my patient can handle. So, one of the first things that I'm going to do when I get ready to perform surgery is do an aseptic scrub on myself. So I'm going to take a scrub brush, and I'm going to get my hands and my arms wet, and these scrub brushes are made with little bristles on one side and then a soapy sponge on the other. And the first thing that we'll do is we use a fingernail pick to pick underneath our fingernails so that we get any debris out from under our fingernails. You can have underneath one fingernail, you can have 100,000 microorganisms. So it's just a crazy number of bacteria that can be there. So we're going to clean underneath our fingernails, and then we're going to get our arms really soapy with this chlorhexidine. This is the same stuff that we just used to prep our patient. We're going to get our hands and our arms all lathered up, and then we're going to scrub for between 2 and 5 minutes with this brush so that we are able to reduce the number of bacteria on our hands and arms, again, to that magic number of only 100,000 bacteria per gram of tissue. Now, as I'm performing the scrub, I'm thinking about the procedure I'm going to be doing. I'm talking with my friends about what we're going to do later on. But the key is, once again, contact time. I can't be in a rush to hurry up and do this. I've got to scrub, and it's not so much the action of scrubbing as it is letting that antiseptic sit on my skin to kill the microorganisms. Now, when I get ready to go into surgery, I'm going to do a few specific things to cover the parts of my body that could potentially be a source of infection. But one of the first things that I will do is, before I go into surgery, I change out of my regular clothes into my surgical scrubs. And that way I am not taking any kind of bacteria, microorganisms from outside when I walk in from the parking lot to work into the surgery suite. I'm putting on a fresh set of clothes for going into surgery. The other thing that I'm going to do is I'm going to take a shoe cover. I'm going to take a pair of shoe covers, and I put these on my feet like little booties. I'll see if we can see this without me falling off my bench. So I put a little shoe cover on my foot, and that way I'm not going to track any dirt from the floor outside of the surgery suite into the surgery suite. Okay? We want to keep the surgery suite as clean as possible. I'm going to put on a surgery cap because I don't want to have to shave my head or scrub my head to do surgery. So I'll put on a surgery cap, and this is going to keep any of my hair from getting in my way, or especially if you have long hair, dropping down inside the animal's abdomen while you're performing surgery. And we are losing a lot of individual pieces of hair per hour that you never notice. I don't want any of my hair to fall out into my patient either. So I'm going to wear my surgery cap. I don't want to breathe into my surgery site. There are millions of bacteria in my mouth, and I don't want to be working on this pet, exhaling on the animal, and just exhaling germs all over my surgery site. So I'm going to put on a mask. And then, if I was really, really concerned about it, there are some microorganisms that we call zoonotic organisms. And that means that they have a high potential to spread from animals to people back and forth. And one example of those is a bacteria that's called brucellosis. And that is a bacteria that can get into the prostate gland of animals. It can get into the bone and spine of animals. And it is easy to spread between animals. So if I was really worried about any potential contamination if I'm doing surgery and I ran into a little blood vessel and it sprayed blood on my face and in my eye, I would wear one of these face shields as well. So now I would be as absolutely aseptic as possible, and I look like I'm ready to go into outer space, and this is going to get really hot in a few seconds, so I'm going to take it all off pretty soon. But this is going to be a way of maintaining asepsis so that I minimize any potential contamination from myself into my patient. Thank you. So I can see you guys again, so you can see me talk. There we go. All right. So the goal is that I'm creating a barrier between myself and my patient. I am also going to put on a sterile surgical gown and sterile surgical gloves. So remember, when something is sterile, that means it has no microorganisms on it at all. And that is the ideal state. That's nothing that we can do with a living organism, but it is something that we can do with our instruments and our gloves and our surgical gown. There is a specific way that we teach our students to put on all of these items in a certain order so that we minimize contamination along the way.
How about jewelry and also long fingernails?
That's an excellent question. So you do not want to wear any dangly jewelry in surgery. So I would not want to have a necklace. I would not want to have earrings that were hanging off of my ears. Anything like that needs to, I could not wear my watch or my rings. All of that needs to come off because all of that can harbor bacteria. As far as my fingernails go, I need to keep them short. I need to be able to only see 1 millimeter of white on my fingernails. And I cannot have manicured nails. I can't have nail polish on my nails or anything else on them. The nail polish on your fingernails is a huge risk factor for spreading a fungal infection to our patients. And you certainly don't want a fungal infection inside of you. So you've got to keep all of that stuff short. You cannot wear anything on your hands or on your arms for your surgical procedure. So, when we sterilize our surgical items, like our gowns, like our gloves, like our surgical instruments, we can do that through a few different ways. And one of those is with an autoclave. And that is a device that you can put certain items inside of, and it creates a high temperature and high level of pressure, so much so that no microorganisms can possibly survive. I can use an autoclave for almost any type of metallic or cloth or non-porous material. There are certain items like endoscopes, which is a long tube with a camera on the end that they could use to go down your mouth and look into your stomach or into your intestines, that you cannot use with an autoclave because the autoclave will melt it. And in those cases, we have to use other types of sterilization methods like radiation or a type of a gas called ethylene oxide or plasma to sterilize those items. Now, I have brought one of my surgery packs here that I use every day. And there are a few key things that we want to look at to make sure that this is sterile. Remember, we don't want to increase our chances of putting bacteria into the pet by using anything that is not sterile. So one of the first things that I notice is that this piece of tape, it identifies the pack, who packed it, and the date that it was autoclaved on. And you can see these brown stripes on the tape. This is heat-sensitive tape, and this tells me that at the very least, this pack was exposed to the correct temperature to cause it to be sterilized. When we open this pack, and there is a certain way that we open it, you'll notice that on the outside the pack is blue. On the inside, the pack is pink. And the reason for that is that if at some point in transporting this pack, it had started to rip open, and I was able to see pink from the outside, I would know that this pack had been contaminated and I should not use it. So we'll open up our pack. We see another piece of that tape on the inside. And then as we continue to open this, we'll see inside of this pack a little indicator. And you can see that on one part of this indicator it says fail, on the other end it says pass, and in between is a black line. This also indicates that our pack was exposed to the correct temperature to cause it to be sterile. If my black line does not go beyond the fail line and into the pass line, I should not use this pack. I should use a different pack instead. And then inside of my pack are all of my sponges and my instruments that I will use to perform my surgery. And these are all sterile, so that once I have on a sterile gown, sterile gloves, and now I am able to pick up my sterile instruments, it is impossible for me to spread any bacteria from myself into this patient. The greatest risk for infection at this point now is the patient's own skin, like we mentioned before. We never want to reuse things that are supposed to be sterile that are one-time items. And an example of that would be syringes. Syringes and needles. Those should be sterile. Those are sterile the first time we use them. We should throw those away and not try to re-sterilize them, re-autoclave them after we do a procedure. The needles become very dull. The syringes no longer they will lose their ability to draw things up and give injections because they get very stiff. So we don't want to reuse disposable equipment. We're just going to sterilize things that we're going to keep for a long time to use for our procedures, like our instruments. We never re-sterilize our gloves or our gowns. Those are one-time use only things. Our surgical environment is something very important to remember as well. Just like we talked about, there are bacteria all over our environment when we're just walking around. There is the potential for bacteria to be in our surgical suite as well, and we want to do everything we can to minimize that from happening. We want to be careful of any surfaces where bacteria could be at. We want to not be moving around a lot in the surgery suite and stirring up bacteria that are resting on any surfaces or that are in the air. We don't want people who don't belong in our surgery suite. We need to maintain a sterile field, and we need to maintain only people that need to be there for our procedure. We're going to have a positive pressure airflow environment in our surgery suite. And what that means is that air will tend to leave the room and not be sucked into the room when the air conditioner or the heater is on. So we're always drawing, fresh air is always coming into the room and exiting. We're never having air coming into the room from outside. One of the things that we need to be really concerned about, and that you've probably heard about on the news, are superbugs or antibiotic-resistant bacteria. And those are very, very common in hospitals because we use a lot of antibiotics, and as those bacteria are exposed to antibiotics, one of their homeostatic mechanisms is to try to survive being exposed to antibiotics. And because bacteria are multiplying millions of times per hour, there will eventually be a single bacteria that is born, that is created, that is able to survive exposure to that particular antibiotic. Then that bacteria starts to multiply, and now I have billions of bacteria that my antibiotic is no longer effective against. We run into that in the hospital setting a lot because we have sick animals that need antibiotics. So there's an example of homeostasis working for a bacteria that is actually working against us, because now we'll get an infection with something like that and we're not able to fight it off. Bacteria have become resistant to antibiotics, but no bacteria has ever become resistant to good aseptic technique. And that is an important thing to keep in mind. So, there are lots of things that we can do every day to help achieve asepsis, at the very least to help reduce the numbers of bacteria and microorganisms that we may run into. And just looking around your classroom or looking around your house, you'll be able to recognize a lot of these. One example is a first aid kit. So things that we can do with a first aid kit include disinfectants that we can use when we have cut ourselves. If we have a break in our skin, putting a bandage over that break helps to cover it up and helps prevent dirt and other microorganisms from getting into it. So basic first aid is a fantastic way to keep an infection from setting in. You can't go anywhere without seeing these alcohol antiseptic gels that you can apply to your hands. And these are great to use. They have an incredibly high kill rate for bacteria and viruses, and whenever I see one, I just go ahead and get a pump of that, because I know that I just touched something that could potentially make me sick not 5 minutes ago. So these are really handy to have around. And finally, one of the most basic things that we can do is wash our hands before we eat, wash our hands after we've been handling any kind of raw food. When you wash your hands, you're not just running your hands under the water, getting a little squirt of soap, and being done in 10 seconds. You want to wash your hands for a good 20 seconds each time. And one of the little memory tricks that we teach is you want to say the alphabet in your head as you are washing your hands. And that will give you just about the right amount of time that soap will have its contact time on your hands in order to reduce the number of microorganisms there. Oh, I believe that we have some time for some questions, so I would be happy to entertain any of those.
How long do your sterilized objects remain sterile? So equipment or drapes, etc.
That's a great question. So the rule of thumb is that once something has been sterilized, it is good for 6 months. There are some things that can change those numbers. For example, moisture is horrible for maintaining sterility. So if I have had, if any of my surgical items have gotten wet, I need to consider that no longer sterile. If any of my sterile packaging has a break in it, I need to consider that no longer sterile. But generally, we will say that they are good for 6 months after they have been sterilized. When we prepare our patients, the antiseptics that we use to clean their skin is effective for several hours, but it's not going to be effective for days and days. So after I have performed my surgical procedure, it's important that I place some sort of a bandage over where my incision is so that I'm able to prevent any contamination from going into that surgery site.
Another question. There's been some talk about hand sanitizer leading to the rise of superbugs or contributing to illness because it kills good bacteria. Is that true, and is it better to wash your hands than to use hand sanitizer?
So the jury is probably out on that, but I think that the thing that we need to keep in mind is that these have been shown in many studies to be very, very effective. like anything, you can overdo it. If you are getting your hands so dried out from hand sanitizer that they're starting to crack, you're probably using too much of it. Hand sanitizers and hand washing have both been shown to be effective. Remember, it's all about contact time. One of the advantages that hand washing gives us over hand sanitizers is that we are, with hand washing, physically removing dirt and debris off of our hands. And that is a good thing, especially if I've been working in the garden and I've got dirt under my fingernails and dirt in the lines of my palm and in my fingers. Hand sanitizer isn't going to be able to kill the microorganisms that are in that dirt. I've got to wash my hands.
What is the most unusual surgery you've done?
Well, let's see. Just the other day, I had to do surgery on a lion. Not the other day. This was about a year ago. But I had a lion, a 450-pound lion, who had a uterine infection. So we had to basically spay the lion. And that is the most interesting surgery that I have done in a long time. She's a very big animal. Her body wall is so strong. It was really hard to manipulate things and remove the organs and do the kind of things that I normally do very easily on a dog or a cat. So that was really quite an experience. She did really well for me.
Is there a difference between human surgery and animal surgery as far as aseptic technique?
Aseptic technique is a universal thing. So as far as getting your incision, your surgery site prepped for surgery, you are going to see virtually the exact same things that we do for animals is going to be what they would do on you.
Does the surgery group at Texas A&M work with the Humane Society or some of those volunteer groups?
We sure do. We work with a number of rescue groups. We work with our local humane societies and animal shelters. And we are there to provide primary care for those animals, make sure that they are healthy and that they receive vaccinations, and we treat any ailments they may have. We also are very involved with performing spays and neuters on those animals so that they are ready to be adopted and go into new homes. In the state of Texas, if you adopt a pet from an animal shelter or a humane society, that animal is supposed to be spayed or neutered, and we provide that service.
How much school, I guess, did it require for you to become a veterinarian, and then is that different than becoming a veterinary surgeon?
Okay, so that's a great question. So veterinary school is a 4-year program. So it's a professional program, and you go into veterinary school after you have completed some undergraduate schooling. So you'll have to you go to college, and depending on the individual program and what kind of prerequisite courses they require, you may do between 2 and 4 years of undergraduate work before you get into vet school. So in my case, I did 4 years of undergraduate work and then went into vet school. So that was 8 years. That was 8 years of school for that. When you graduate from veterinary school, you are now a DVM, a doctor of veterinary medicine, and you can go into practice, you can own your own practice, you can go work in someone else's practice, you are qualified to perform surgery, medicine, do virtually anything that you feel comfortable about or that you have learned about in any species. Now, you can go on to become a board-certified specialist in things. And so if you were to become a board-certified surgeon, that would mean that the only thing that you would like to do or were really interested in doing for your career was animal surgery. So after your undergraduate school, after vet school, you would typically do a year of a training program called an internship. You might have to do a second internship after that, so that's 2 more years, and then 3 or 4 years of a residency program. So you are looking at adding on about between 4 and 6 more years of training on top of your veterinary school in order to become specialized. That's a lot of school.
How many people assist you in a surgery, and what qualifications do they have?
So that's a great question. Here at Texas A&M, because we're a veterinary school, we have students that are assisting in every surgery because they have to learn. Typically, when you are performing a surgery, you will have at least one assistant, and that assistant is probably going to be a veterinary technician who has gone to technician school to learn the basics of animal health and physiology and homeostasis and the basics of how to best assist the veterinarian in their job. So you will usually have at least one of them. If it's a very involved surgery, we've got a leg that is shattered that requires a lot of work, we may have 2, 3, maybe 4 additional people in there to help hold things and help manipulate structures so that we can get that limb fixed. So it varies, but usually you'll have one person who assists you.
We're mostly talking about elective surgery here, but what happens when a dog got hit by a car and it comes in, a bone's poking out, and several things are wrong? How do you know what to do first?
All right, so that is a great question, and that is one of the nerve-wracking things when you're a new veterinarian and starting out. But here's the most important thing, is that it doesn't do me any good to fix a broken bone if my pet can't breathe and it dies because it can't breathe. So we prioritize things, and the most important things are that we have to have a functional cardiovascular and respiratory system. So step 1 is to evaluate the heart, the blood vessels, and the lungs and the airway, and make sure that those are functioning correctly. And if the animal is in a state of shock because of its trauma, we have to correct that first. So step 1 is keeping the organs that are going to keep us alive functioning first and making them the first priority. It's no fun, but I could live with a broken leg for some period of time, but I'm not going to live very long if I have a punctured lung. So we have to prioritize, and that's called triage, where you prioritize injuries in the order of their importance to correct. And that's how we do that.
I think that has used up about all of our time today. If you'd like to know more about what Dr. Stickney does, or anything relating to veterinary science or animal health care, things of that nature, visit the PEER website at peer.tamu.edu. Thank you so much for joining us today.